From humble beginnings with a desire to serve the Dudley community, Bank of Dudley has grown to 5 locations, serving Lawrence, Twiggs, and surrounding counties. Serving our community since 1905, the Bank of Dudley is looking forward to its 2nd century of community banking. Drop in today to any of our 5 locations: Jeffersonville, Dudley, East Dublin, Veterans Boulevard, and downtown Dublin. Bank of Dudley, member FDIC, and an equal housing lender.
Hi, I'm Don Carswell. Come into Dublin Nissan this month and buy a new Nissan and pay 0 interest for up to 7 years. And don't forget our 2nd annual 12 Days of Christmas. Wishing you a Merry Christmas and a Happy New Year from Dublin Nissan.
Welcome everybody. I'm glad to have with me today Dr. Erich Randolph, a fairly new doctor here in town. Dr. Randolph, we had lunch, a couple of months ago in downtown, and got to know each other, and I was excited then, and you and I talked that day during lunch. I said, I got to get you on television. And I finally twisted your arm, and I'm kidding about that. I didn't have to twist his arm. He is busy, but first of all, thank you for working me in today.
No, thank you for having me. I mean, it's important to get the word out about cancer and just about healthcare in general. So any opportunity I get for that, I look forward to it.
Absolutely. Well, we have a few topics we want to talk about today, and we're actually doing this first series is a 2-part series. So we're going to tackle part of it on this show, and then we've got another show coming up in a week or so. But Dr. Randolph is an oncologist, Emory trained?
No, I did my radiation oncology at MD Anderson Cancer Institute in Houston, Texas, and before that I did 3 years of internal medicine at Emory University Hospitals.
Well, MD Anderson, they definitely one of the elite, and some of the things that we're going to be talking about in this 2-part series. I studied some of the focus groups from MD Anderson. They're really, they believe in focus groups and to get in there and find out what's going on with patients. They do focus groups with thousands of people, literally. So, and I know you're aware of that. But well, first of all, you have joined CurePoint Cancer here in Dublin.
Yes.
Tell me a little bit, or tell our viewers, I know quite a bit, but tell our viewers about CurePoint Cancer and why you decided you wanted to team up.
Well, I know the owners of CurePoint, Philip Miles and Daniel Dudley, and they had been talking to me for about a year about coming down or looking at it, and circumstances and situations always are evolving, and so I said, well, let me come down, and I came down and saw that it was an opportunity to achieve different things. One, to provide good cancer care in the community, not to say that it wasn't there before, but I think it always can be enhanced. And then just to get a different perspective on healthcare in a smaller town setting, so to speak, because I think sometimes the impact can be better if you catch people at a earlier stage of things.
One thing I don't understand, and I'm from Dublin, Dr. Randolph, and maybe you can guide me through this, but I don't understand why people drive to Macon and Atlanta or Savannah to get radiation treatment. We've got state-of-the-art technology right here at home, and I know many friends that have had cancer. Some have beaten it to some degree, some have not, but I don't understand why people want to drive to get radiation treatment when it's right here. Help me there.
I will help you as much as I can, but one of the things that I think is very important is an awareness of what resources you have in your community. And I unfortunately had that strike me when I first came on one of my visits. I went to Fairview Hospital and was just casually talking to some of the people who work there in the lobby, and they had never heard of CurePoint. And I was surprised because it's right around the corner from Fairview. And so clearly awareness needs to be higher. And so if you don't know you have a resource, you're going to go to where you think you know there are resources. So that's one of the things. Another reason people sometimes leave where they're at is because they think the food is better somewhere else and that the services are better somewhere else. But again, that also goes into play with not knowing what you have. And then thirdly, you go somewhere else because somebody recommended that you go there because they had a good experience, and that sometimes leads you to another city. And then another reason, which is maybe the more significant one, is that if there aren't the services that you need in your location, you will go, if you're able to that location. Now, for myself, I've always been very comfortable in terms of treating most about any type of cancer. But, even in my private practice that I was in before, I also knew what my limitations were. And if I didn't have the technology or the experience in doing a particular procedure, I would tend to try to identify where the patient could go to get that. A lot of times I would refer people to MD Anderson because I knew that they were the creme de la creme, and pretty much they could offer anything that even Atlanta did not have. Even though you have Emory there, MD Anderson is just a completely different experience. But coming here to Dublin, what I recognized at CurePoint is what they had a lot of the infrastructure to give the state-of-the-art treatment and care, but people did not know it was there. And that, to some extent, could be marketing. It could be, some extent, the referring doctors don't even know what they have right outside their door, so to speak. And some of it are just people dynamics in that, if your family member had their treatment somewhere else, referrals are a very big thing in terms of people's experiences. And so a lot of times you will go if you knew a cousin or aunt or uncle who went somewhere else to get that care. And so again, it's a matter of overcoming or educating those hurdles that exist. And so I think those are some of the major influences of sorts. But again, educating people to what they have in their community is very, very important. But from a technology standpoint, we have image-guided radiation, which allows targeting very specifically to the tumor site. We have CT simulation, and we have, even more importantly, a solid team of staff in terms of physics support, which is very critical in radiation, and then our therapists who deliver the treatment, and our front office people, because the people in your office make or break your practice, and they are your bridge to the community and to your patients. And if you have a great staff, you really will have a great product to deliver to the community.
Well, we know we got that. So now that you've said that, there's no excuse if you're watching us now, and we're literally shouting this from the rooftop because we're basically right here on the rooftop at Dino's in downtown Dublin. So we are shouting it from the rooftop, but there is no reason to drive for miles and miles because we have that technology right here at home. And for anybody that's watching us, someone who has had cancer, you don't want to have to drive if you get radiation or chemo or whatever you may be getting. So please share that with your friends and neighbors or people at church. You've heard Dr. Randolph talk about it, and we have the same technology right here in Dublin, Georgia, than you can get in all of the big cities. So, and I do agree with everything you said. But we're going to take a commercial break, and we'll be back right after this.
Hi, I'm Don Carswell. At Dublin Chevrolet, we're celebrating Christmas with employee pricing. And don't forget our second annual 12 Days of Christmas. For more details, go to mydublinchevrolet.com. Merry Christmas and Happy New Year from Dublin Chevrolet.
When the power's out, you're out of business. But with natural gas With the City of Dublin, when the power's out, you can still cook on your gas stove or shower with your gas hot water heater or even fire up the grill. Plus save money every single day because natural gas costs half the price of electricity and propane. Start saving today with the City of Dublin Natural Gas. Call Brad Grimes at 277-5048 and you'll never be out of business with natural gas.
You want to acquire real-world skills instead of student loan debt? OFTC gives you an opportunity to succeed in a safe and caring learning community with flexible classes on campus and online. In just 2 years, you could be ready for a career in a lucrative field that you love. Whatever lies ahead, education and skills training from OFTC can give you the confidence to succeed.
Oconee Fall Line Technical College. Think differently about college. OFTC is an equal opportunity institution.
Welcome back, everybody. I'm continuing my conversation with Dr. Randolph. He's an oncologist here in town, and we're talking about, first of all, CurePoint Cancer. State-of-the-art cancer care right here at home. You don't have to drive miles and miles, and we're going to drive that point home for the next little while, but explain to me and to our viewers exactly what radiation is.
Well, radiation is a form of energy, and light is a form of energy, but radiation as it applies to cancer is the use of beams of energy to kill the cancer cells in a body. You also have radiation when you get a routine chest x-ray, but the radiation that is utilized for treating cancer is of a much higher energy and strength and ability to penetrate at different depths inside a person's body or outside the body to deliver dose to the cancer site and the surrounding area that may be at risk.
Okay, and it confuses me a lot of times because I know people that have gotten radiation, I know people have gotten chemo, and some people get radiation and chemo. Explain that to us, and why do you get one or the other or both?
Radiation is much more targeted than chemotherapy, although nowadays there are what are called targeted chemotherapy regimens that are specific for certain genetic tumors or tumors that have a profile that certain chemos are receptive to. However, historically, chemotherapy is given through the vein or orally, and it's then circulated throughout the body, wherever your blood flow goes. And where it goes is where it will cause good things for where the cancer's at, but it can also cause side effects from where the cancer's not, but the normal cells will be affected by it. With radiation, we are targeting, we're not shooting the entire body, we are targeting where that cancer is located, be it the prostate, the breast, the lung, or even the rectal and colon area, or the cervix or the uterus, and or even the brain. And so we're targeted, so it's really focused at the site of the tumor, and the side effects that are associated typically are associated to the region where it is specifically targeted at.
Okay, does radiation treatment damage normal tissue?
Yes, it does, and the effects of that, there are kind of two different categories. There are what we call acute side effects, and then there are chronic side effects. But one of the things about radiation that is important, be it for acute or chronic, is that the body is an amazing thing, and that we have learned to understand that we have the ability to repair damage from radiation, provided it is not what we call an overdosage of it, and that is what allows us to deliver radiation to the cancer even though there are normal cells around it. Cancer cells do not have the mechanism of the cell to repair radiation damage like normal cells. And the reason we give the treatments every day is that that day break in between allows the normal cells to do the repair work on those cells to recover so they're ready for the next day's treatment. the cancer cell is not able to repair itself as readily, and therefore we then hit it again the next day to hopefully increase the chance of killing the cancer cell and establishing cure. We have radiation damage to our body every day from the atmosphere, from going out into the sun. People who go to the beach and over suntan or whatever, they're damaging their skin, but the skin has mechanisms in the epithelium or the outer layer of the skin that can repair some of that radiation damage. But that's why sunscreens are important, to not overwhelm that repair system. But it's the ability to repair from radiation damage that allows us to differentiate and give radiation to kill cancer cells. The side effects relative to different regions depend on those organs that are there. And so basically, cells that are rapidly dividing are more susceptible to radiation. So when we treat, let's say, a colon cancer, well, your intestines are rapidly dividing cells. And so, unfortunately, that's why patients may have diarrhea, because that lining of the intestines may die, and therefore you can't absorb water, and therefore you end up having diarrhea. But those cells that are healthy will lay down a new lining once you finish treatment or you give medications to help control it. But the cancer cell is not able to repair, and so patients will recover from those acute side effects. Now, in some patients, they will develop what we call scar tissue or fibrosis. Just like when a person has an operation, the tissues heal, but it is not like the original tissues necessarily that were there. And the body makes collagen and lays down what we call scar tissue to help with the healing process. And in some parts of the body, the side effect is scar tissue that, let's say in a patient who has had head and neck cancer or even breast surgery, the scarring may be enhanced. That will be restrictive, like for a woman to raise her arm if she's had axillary or lymph node dissection. And so we tell them to do exercises to stretch the scar tissue so that their range of motion is not impeded at all. So again, it really depends on the specific part of the body in terms of what side effects you might have short-term and what side effects you may have long-term. But most times the side effects long-term don't create a disabling situation for most patients.
Staying on side effects, I see people on chemotherapy that have a problem with nausea and are sick, and somebody drops them off and has to take them home. Well, when I'm at Cure Point, I watch people come in all by themselves. They go in, they disappear for about 20, 25 minutes, and they come whistling out, basically, get in their car and drive themselves home. So tell me about that. Explain that to me.
That comes down to the fact that where we're delivering the treatment, it is to specific organs that don't necessarily influence things such as nausea or vomiting. With chemotherapy, it is getting throughout the body. So it is affecting so many different portions of the body that it can cause the nausea, it can cause the diarrhea, it can cause the fatigue. And all of those things cumulatively cause patients who get chemotherapy more often than not to be more fatigued and just worn out from the actual treatment. You know, patients who get radiation sometimes can get nausea, but it's a lot of times is not when they're actually getting the treatment. They could go home and be smelling an odor that may trigger that nausea sensation. But otherwise, a lot of patients bring themselves to treatment, go to work, go home, and just rest. And you know, one of the keys also for people's ability to handle side effects is their nutritional status. Now, more patients typically with any form of treatment, be it radiation or chemotherapy, may lose their taste buds and the desire to eat. So it's important to keep an eye on patients' weight and their nutrition. But usually that's much more of a problem when patients are getting chemotherapy. But again, a patient who is nutritionally tuned up can usually tolerate the radiation and even in some situations the chemotherapy.
So how do we stay nutritionally tuned up? And are there diets that will help us over long term? I know maybe you can't prevent getting cancer, but maybe to decrease the odds. Are there diets? Are there things we should eat? And I know you don't want to eat a bunch of fried food for your heart, but there again, are there diets that we could use to maybe help ourselves maybe not get cancer?
That is not a loaded question, but it's a question that does not have a specific right or wrong per se. You know, one of the things though is that on this earth we've been given things to eat. And you know, fruits and vegetables are very critical things. And they allow us to replenish our body in many areas that allow our immune system to be healthy. And you know, unfortunately, we're in this time of COVID-19, but what we're definitely seeing is that certain nutritional supplements are helpful. We find that patients who are taking vitamin D tend to do better. Patients who are taking magnesium and zinc may also be doing better. And you know, vitamin D is almost like an essential element, so to speak, because it's actually also a hormone, but vitamin D years ago has been discovered to reduce cardiovascular events as well. And for prostate cancer, let's say, we find that patients who have vitamin D deficiency may have a higher risk of developing prostate cancer. And it doesn't mean that if you just stop it or that you're going to get the cancer, but there's that association of depletion of certain nutrients that may be associated with some cancers. You know, the fruits and vegetables are important because not only the nutrients they have, but the fiber that's in them. And you know, my belief, and if you look at certain countries that have high fiber diets, you know, gastrointestinal malignancies are less, particularly like colon cancer, because again, you want to increase the moving through your intestinal tract of all those toxins you may have taken in beforehand. But if you're constipated, they're just sitting there creating a state of inflammation and things like that that could potentially lead to cancer. So again, having a high fiber diet helps in that regard as well.
Plus, they're delicious.
Yeah.
I mean, fruit, how do you beat fruit? We keep a big bowl of fruit right in the middle of our table, and you know, eating an apple or two is a lot better than eating cookies for you anyway. Yes. But and once you get used to those things, grapes and apples and different things, it's just, you know, it's like you can't get enough of them. And this time of the year, everybody's eating oranges, so when you get those fresh fruits, blueberries and things like that. So back on radiation a second, are there different kinds of radiation?
Yes, there are. Years ago, cobalt-60 was the standard element that was utilized in cobalt radiation machines. But technology has evolved where we have machines called linear accelerators that can create different strengths of energy that can penetrate into the body to deliver dose to where it's needed. There's also another form of technology called proton beam therapy, which is a higher degree of sophistication and energy that can titrate doses at different depths. That technology is extremely innovative and good, but the caveat on that is that not every tumor needs proton beam therapy. And proton beam therapy, in my opinion, is best used in pediatric cases because you can spare a lot of the sensitive normal tissues of younger people, and you can spare other organs that don't need dose. So pediatric cases, certain spine tumors, even certain brain tumors, and some eye tumors are where proton is probably more efficacious for using. Now, a lot of times when they first came out, protons were being used for prostate cancer, And that really drove a lot of people to getting those machines put in. And one of the things is, though, there are other techniques of radiation that are much more cost sensitive and do just as good a job. And that's where you utilize implants, or what we call brachytherapy, which is the use of a radioactive isotope that could either be permanently placed into a tumor or it can be temporarily placed there. And with implant treatments with radiation, the radiation is given off within a certain range, let's say maybe 1 to 2 centimeters from around where that source is. So if you think about a prostate just being, let's say, an orange, well, if you're loading it with the radiation, let's say on the outside of the skin, you're not getting very much dose. So you have spared a lot of the normal tissue, but you're giving the concentrated dose right where the tumor is. And that is very much cheaper than a proton machine, because a proton accelerator can cost over $10 million. And so when you look about healthcare costs, one of the things that people are really starting to look at more, well, what can we do to effectively treat people? We want the newest technology, but do we always have to use the newest technology if it is cost prohibitive and you're not able to take care of as many people in that setting?
We don't realize a lot of times we complain about healthcare costs till we need it, and then we really don't care what it costs, So I think that's just human nature.
That is human nature, and it's human nature. We need to reorient our thinking, because one of the things that I guess I always kind of use to my patients, because I believe in preventative care, and the thing that I always throw on patients, well, do you drive a car? What type of car do you have? Do you just look at the lights, or do you listen to your car, and when you hear a noise, you say, oh, I better take it to the mechanic, or do you wait till the wheels fall off? Or do you look at the light that says oil needs to be put in it? And I know every day you know that it needs gas, so you give it the gas, the nutrition it needs to function. So we have the most perfect machine that God has given us in our body, and we just need to appreciate it and take care of it, because it'll take care of us in the long haul. It's nobody's going to be immune to live forever, but again, if you take care of the vessel you're in, it will give you good usage.
Amen. The Bible even says it's a temple, and we're to take care of. God commands us to take care of our bodies. We don't always do that, but you're right. You go out this morning, and of course a cold day like today, and it's knocking, you're not going to drive around till it just absolutely stops side the road. So, and we're going to be talking a lot more about that over the next few months. Not only I'm going to have Dr. Randolph coming on talking about that nutrition, but in January 28th, we're going to be having a town hall meeting here in Dublin. And we're going to get, you think we've got in depth today, we're really going to dive into this topic, because we want you to live. And I know when we first talked, Dr. Randolph, that's one thing that I heard you keep saying over and over, was that preventive and eating right, putting the right things in your body, because you want people to have longevity and to have healthy lives. So that's what I'm excited about. And we're going to be sharing more of that with you. But we're going to take another break and come back and wrap things up. Stay with us.
When it comes to handheld power tools, there's no better name than Echo. From our consumer grade to professional blowers, we've got what you're looking for. We have hedge trimmers, string trimmers, and pole pruners to cut any job down to size. And Echo's battery-powered equipment gives you gas-like performance without the hassle. So come see us at Myers Equipment and Supply, 301 North Jefferson in Dublin.
At Lakes Alignment, we would like to take this time to thank our community for your support over the last 66 years, and especially these last few months with the opening of our brand new truck center. When you drive into Lakes Alignment, you get master trained technicians like Anthony Penny. Everybody calls him Bug, but it means so much to us. And on behalf of Neil Harden, Lisa, our staff, and the entire Lake family, we thank you for supporting us since 1954. Come see us today. We open every morning at 8 o'clock, and now our truck center is open on Saturday to serve your big trucks and equipment from 8 until 12. At Lakes Alignment, we thank you and this entire community and will continue to serve you with the best trained staff and friendly, courteous service. Lakes Alignment, hometown people serving hometown people. Come see us today, 104 Johnson Street, East Dublin.
Hi, I'm Don Carswell. Come into Dublin Nissan this month and buy a new Nissan and pay 0 interest for up to 7 years. And don't forget our second annual 12 Days of Christmas. Wishing you a Merry Christmas and a Happy New Year from Dublin Nissan.
Welcome back, everybody. Going to kind of wrap things up with this first segment. We've got a series of these shows that we're going to be doing over the next 2 or 3, 4 months, as long as we want to do them. But got a lot of topics. Our next show we're going to do, I'm excited about. We're going to talk just to the men. We've got a lot of men's topics we want to talk about, and we want you to really pay attention to that. So before we go, Dr. Randolph, I just want to ask you, what are some of the most common questions that your patients come in and ask you? That's another loaded question.
Well, yeah, one of them.
He may not
probably,
come back and talk to me again. So.
No. One of the questions is, why do I have to come every day? This is a long process, and and that's a common question. And technology has and research has allowed us to see that we can, in some cases, condense the total amount of time necessary for treatment. And so that's been a big plus in many regards. It frees up the patient's time. It takes them less away from their job having to come for treatment. But that is a fairly common
well, we didn't get here today, so it's going to take a little more time to get out of it, too, don't it?
Yeah.
But radiation, a lot of people come for X amount. I've just had a friend finish radiation. He went 33 days, and it was every day. I think Monday through Friday actually. But what happens? It's the last question I want to ask. But what happens before radiation, during radiation, and after the radiation?
Well, if they're just getting radiation treatments and not in addition to chemotherapy, there's really not much that's going on with them other than them psychologically becoming in touch with the need of what they have to do if they want to hopefully beat the cancer. During radiation, it's being involved with the people in your social world to be your support, but also maintaining good nutrition and communicating with your doctors if you're starting to have problems, so that if there are problems, they can be addressed right then to hopefully not allow them to get worse. And then after radiation, it's recovery. And that involves good nutrition, rest, and then follow-up visits with your physicians to make sure everything is under control. Now, follow-ups are one of those interesting things because, insurance companies want to limit sometimes how often you go back to your doctor and the sort. But, again, having a physician who will, one, educate you as to things to look out for will be helpful in your own follow-up. But above anything else, if you notice something that is out of kilter with yourself, then you go and, and get it taken care of. But I would say the biggest thing after completion of treatment is the follow-up, because patients all wonder, is it all gone? Did I get it all? Did we take care of this? And that is unfortunately a thing we don't have a crystal ball on. There's certain statistics out there that say if you caught the cancer at a stage 1, you may have a 95% of cure, but if it gets to be a stage 3, it may drop down to 50 or 50% or less. So it depends really, again, on the stage of the cancer, but whether they're going to live and beat their cancer is a very much a significant thing that is in people's minds.
Yeah, and I said that was the last question, but you got me thinking there about COVID, and as you answered that question, and Dr. Randolph, and you and I have talked off camera a few times, but during COVID, so many of us, and I'm in there with those of you watching now, we have put off going to the doctor and seeing our internal medicine doctor or our urologist or gynecologist or whatever, and now we hadn't went because we're scared to go to the doctor's office. I don't want to wear a mask. all these things. And now when we go, it's not stage 1 cancer, but it's 2, 3, or 4. So we don't know how long COVID's going to last, but what do you say to the people watching? Well, say to me too, about that, about putting things off because of COVID.
I would say that if something is dramatically different from your normal routine, forget about COVID and reach out to your healthcare provider, and they will help you navigate how to get in to see them. If you're coughing up blood and you've never coughed up blood and you're doing it not only every day but more frequently, there's nothing to wait for, okay? If you're having chest pain, and when you're just at rest and you've never had that happen, or if you're walking up the stairs and you get chest pain, you don't wait just because of COVID, because a heart attack or a bleeding tumor in your either lung or in your esophagus, that will take you out. COVID is very scary, and if you have quote unquote access to the right treatments, it can be managed. And it's a good thing that the vaccine has come about, but there's still a lot of unknowns about what does it really mean in terms of the after effects, because there are things with patients who have quote unquote recovered from COVID who have lingering effects. And that's why it's very critical to be preventive by wearing that mask, by keeping distance, and by washing hands. And one of the things that I always find very interesting is everybody pushing back on the mask, but I remember as a kid, seatbelts weren't in the car. And then suddenly seatbelts were not only in the car, but they were mandatory. And it may not be enforced as much now, getting a ticket, but the way the manufacturers, that car buzzer will keep going off until you snap.
Drive you batty.
Yeah, drive you batty, exactly. And so, to live to me is a blessing, and if a mask can help prevent that, that is a good thing, I mean, things, believe it or not, could be worse than this. And, I hate to go always, I mention to people, have you ever looked at an apocalyptic movie? It's a bad situation. So we don't need to let it get to that bad a situation. We need to be concerned about not only ourselves, but the people we're around, and protect them as best we can until this virus comes under control.
Now you see why I wanted him on so bad. I've got so many questions, and we're going to be asking all these questions over the next few months. And if you've got a question, call it into the station, post it on our Facebook page. We have an answering service if nobody answers, but call your questions in and let Dr. Randolph answer those questions in maybe a future show. That's going to do it for this show, but we're going to be back in a few weeks. We want you to tell your friends, tell your family about this series of shows. If you're catching us at the tail end of this, it will be aired again, or you can go on our YouTube channel at TV35 WDIG. Just put that on YouTube, and you can pull this up under CurePoint. So you didn't just have to miss the whole show. But and make sure you tell your husband. Our next series of shows are going to be about men. And you know how hard-headed we are. Yes. I mean, and you got two men here saying yes, so, and I admit that's one of our idiosyncrasies there, that we are hard-headed by nature. But we're going to be talking to men on our next episode. But Dr. Randolph, thank you so much.
Thank you for having me. I appreciate it.
Absolutely. And thank you for joining us today on TV 35. And make sure you join us for our series of shows coming up very soon. Thank you so much, and Merry Christmas.
Merry Christmas to everybody.